Hey guys, it's Bryn with the Mom on the Rocks, and I'm here with the person that I call the chief of my village, Melissa Bates. And I just noticed you're wearing my shirt.
I am. I have been rocking, and underneath this, I have the T-shirt.
Perfect. So walking billboard, I love it.
Absolutely.
So Melissa, if you've been here long or you've been through the archive of videos in the extreme parenting private community, you know Melissa well. She's my favorite person to interview on here as an expert. Melissa is an extreme parent to 4 children, 2 extreme kiddos. She is an entrepreneur. She runs her own business. She is like my personal hero. She's the person who, you guys, there was a time in my life when Melissa watched her 4 kids plus my 2 kids, and that is not a joke. I think once you pass like 3 or 4, it just feels like you don't even really notice. Maybe more people, I don't know.
It doesn't matter. And mine are like yours, so it was just
probably the actual only person who, when they tell me really it's fine, I believe them because I know that you know. And then the most important thing for this particular video that I want you guys to know about Melissa is she's written, I don't take guest posts, I haven't for a long time on my site, but Melissa wrote a guest post, like 2 years ago now, I think.
Yeah.
Yeah, called The Real Face of ADHD. And she was diagnosed young, and she'll talk about that, about her own diagnosis. But I think one thing that's really kind of awesome about her is that she can speak to us from the extreme parenting side, from the social worker side, as well as from experiencing diagnosis herself, especially back when Melissa and I are in the same class. Hey, Samantha. And so she is able to speak to it as what it was like going through diagnosis herself. And I want to touch a little bit on today the piece of misdiagnosis. It's something that is a common problem in our broken system, especially with girls. And especially when you have things like low socioeconomic status or ethnicity or something like that that plays into the picture that gets you poorer quality of care. So Melissa, talk to us a little bit about your diagnostic experience. Granted, this was like 30 years ago, which seems impossible, but it's true. So talk to us a little bit about what that looked like for your parents and what that looked like for you.
So I specifically, so I don't remember, but I was been specifically told that in school I would just get up and go, and I do remember kind of just like getting up and going and not really thinking anything of it, but I would just get up in the middle of the class and just walk around the classroom, and my mom said I would just walk by people and like smack their heads. I have no memory of that. Which I'm sure played into why I didn't have many friends. But I have no memory of that. But I do remember getting up. I remember walking back and looking at like the bulletin boards and things like that, and like reading the things that the teachers are putting on the walls, and just randomly. And I remember a couple of teachers just like calling me out in class, and then a couple others that knew my parents and kind of knew a little bit before I had been diagnosed. Because I'm the youngest of 4, and I have a brother who has ADHD and Tourette's, and so they kind of knew him, so they knew me, and so they would kind of walk back to me and just kind of guide me back to my seat while they're still teaching, so it didn't draw attention or anything like that. So I remember that, and my parents started seeing those kind of signs and started getting those kind of reports from class and from teachers, and so they would call the doctor and say, listen, we think something's going on. We're pretty sure this is what this is. But again, back when they didn't really have a lot of information about it, but my mom had been so familiar with it personally because of my brother, and my other brother has Tourette's. So and some of those symptoms kind of crossed. So she was very familiar with it, and she knew a lot of the research that the doctors didn't even know. So she did a lot of fighting for me. And so we drove to Akron to get tested and all that kind of stuff. And I just remember going, and I swear this doctor, I don't even know if anybody remembers this, but this doctor looked exactly like the guy from that Father Dowling Mysteries.
Oh my gosh.
Does anybody even remember that? I'm like 80 years old now. but that was the big thing that stuck out to me, is because we went there and he was really nice. He was really calm and just really good. And I don't remember anything specific to, okay, this is why we're going, this is what's wrong. It was more of, my mom did a really good job at just saying, this is how we're going to help you. This is how we're going to help you fill in the gaps that everybody has, but you seem to have some that others don't. So we're going to try to fill those in for you, kind of thing, and give you the tools to do that. So she was always really good about that. And they always made it to, which I'm thankful now, they always made a point to, be responsible for your actions, but there is a reason why. And this is how we're going to take care of it. So they're always really honest with me. So I remember that part of it. And I remember going to the doctor and trying different medicines, and some of them made me very sick. But there was one that worked that made me sick, but it worked. And my mom was like, we're going to keep that one. Because I'm my daughter, because,
Yes, I do know. I do know that.
Yes. He said, yeah, I'm her. So she was like, it's worth it. We're just going to give you food when you take your medicine and it'll be fine. So, and it was for a while. And then it just kind of started not working because there was liver enzymes that were shooting through the roof and stuff like that. So there were some changes we had to make there. But I just remember it being like, kind of like now, but just on the other side of it, being the patient, like being the kid with ADHD, just that ongoing, okay, what are we doing now? Okay, it's this medicine now. Okay, this is what I'm taking now. Like that whole thing of, oh, this is life now. Okay. It's like, it just it was never a big change in my head. It was never a big change in my life. It was just kind of, oh, okay, this is how we're doing it now. So, and I never between me and all the other kids. I thought everything. So.
How did that translate for you? Like, now that you're an extreme parent and you've got 2 of your 4 kids that have diagnoses or in the diagnostic process. So now that we're 30 years into this, and there, of course, are still doctors who are overdiagnosing and overmedicating. However, it's much more oriented toward therapy. And Samantha's on here, and we talked to her last week about behavioral therapy and interventions and strategies and things that can go into place in the classroom and different things like that. How do you see that as a difference from when you were growing up? And those really weren't interventions. It was kind of left up to the teacher to like use classroom management at the end, versus how things are now, both in the school system and at home, because you mentioned you're the youngest of 4, you had siblings that had other diagnoses. So how did that kind of translate from then to now?
So as a kid, when I was growing up with this, there really wasn't anything. There weren't the therapies offered. I think the only therapies that really offered were for like kids with extreme disabilities kind of thing, like PT, OT, all that kind of stuff was only for kids with like physical disabilities. So none of that stuff was really an option. And the thing that my parents found really helpful was just keeping me busy, which is why I played sports so much. That was really good for me. And there really wasn't the training, the education for the teachers to be able to intervene the way they can now. And so my mom did a whole lot of fighting. She was in the school, in teachers' faces, in the principals' faces, weekly. And she said there was a point when she would walk in the building and she could physically see their demeanor change. Because it was like, oh crap, what happened? Who did what? Like, she was coming in to fight for me. And so she said, I didn't care what anybody thought. I knew my kid and I knew what I knew, and they didn't. And it's not necessarily their fault because it wasn't available to them. But at the same time, you can't let your kid fall through the cracks. So now,
I think we would all say that we fight that same battle. No matter whether we fight it with, kindness and gentleness or with our fists some days, it feels like. At the same time, I think that we all understand that in some scenarios, school especially, advocacy is kind of synonymous with fighting. And that's frustrating, but it's true.
And I honestly, I just did that a little bit tonight with a nurse that was trying to get my 6-year-old to describe he just had surgery on his skull, like part of his skull removed and like his C1 vertebrae, part of that removed. So he's got some head pain. And the nurse was trying to get him to describe his head pain on a scale between 1 and 10. We've been here for 4 days and they haven't been doing that with him at all. And I'm like, he's not going to know that. And he said, oh, okay. So he's trying to explain it to him. And he's got his medicine in his hand and he won't give it to him until he explains that, like until he gives him a number. And I finally just looked at him and I said, listen, I'm on day 4. I am sleep deprived. I'm going to need you to give him his pain medicine because he's in pain and he's 6. He doesn't know your numbers.
Yeah.
He just looked at me and he was like, okay, I'm just trying to explain it. I said, I understand what you're trying to do, but it's not working. And you've been waiting there 5 minutes. Give him his pain medicine.
Yeah.
He goes, okay. But it's just one of those things. It's like another aspect. And it's partly because he's a little bit delayed in his learning because of the things that he struggles with. So it's just that thing that people don't understand. And you're always educating, always trying to explain things. And I probably could have been nicer, but I'm sleep deprived too. So,
right. Yeah.
It's an education thing all around. And the teachers now have a lot more of that. And there's laws in place, that say they have to provide these things. If there's an IEP, a 504, whatever, they have to provide these things. They have to make things available. And back when I was growing up, they didn't. It was just 25 kids in the classroom, good luck kind of thing. So.
Yeah. And I've spoken to this before, but I think it's important I will mention it every time from the teacher's perspective, because I was in public education for so long. So many teachers, I try to advocate as much as I can for teachers. But at the same time, there are teachers that are great, wonderful teachers, good people. They sincerely want what's best for their kids, but they don't understand the diagnosis or what goes along with that. So they might have somebody like you, Samantha, that can come in and work alongside the child and help that student. But in many cases, we're lacking the finances to have enough aides, to have therapy and interventions, to have anything like that. And so, I've always taught in either inner city schools, which were, a whole different level, or low income schools. And so my kids didn't have access to any of that. And so if left up to the teachers, to be honest, they're doing the best they can do to make it day to day. So getting those interventions actually in place for those kids is highly unlikely. So if it isn't for the parents really knowing their rights, like Melissa's talked about that before, if you guys haven't watched the video she did specifically about IEPs in your IEP binder, you need to go back and find that because it's like gold. But knowing your rights, knowing how to speak up for your kid and what things to say, because a lot of kids like ours are ones that fall through the cracks or they get labeled, and then that's a whole other conversation. So one thing I wanted to talk with you about tonight, Melissa, and you and I talk about this on a friendship level a lot, is what do we do? And I know a lot of mamas in this parenting community talk about this. Talk to me about some strategies. We know that when you're parenting a child with special needs, whatever those special needs are, that you have that level of the increased rate of divorce, the increased rate in stress on, 2,000 different levels. So talk to me about some strategies that you and Bobby, your husband, use, because you guys have been married just a little longer than Spence and I, which is basically 100 years. Talk to me about some strategies that you guys have. And I'm not talking about just, this is our tried and true method and this works great. Because if we're all being real, there's no one thing that works great every time.
There's no tried
with our kids or our husbands, because sometimes those are the same, if you ask me.
There's
if we're really being honest. So talk to me about, about some of those strategies. What are some things that have worked for you guys? What is like, hey, don't do this because you'll blow it. Talk to me about that.
So with my husband, he's an accountant. So everything is in a box. Everything has a place, and our kids are included in that, and children in general are included in that sometimes. And he has a really hard time going, okay, it's kids. Kids do this. Okay, this is our kid. Our kid does this. This is what happens, and just letting it go. And our oldest is now hormonal. She's 10, but she's starting that hormonal thing. And her therapist was like, you might want to start tracking some of those anger outbursts and things like that. And my husband was like shut down. He's like, nope, done. I can't do it. So at that point, it was kind of like, okay, it's just pulling away, not in the moment, but pulling away and be like, okay, this happened. You exploded a little bit. What was going through your head? And if it's just that whole, they just need to do this. It's just a reminder of, they can't do that because this and this. And then it's just kind of talking through his frustration through it, because we all get frustrated. We want them to be like, we tell them to do something, they do it, but that's just not reality. especially with extreme kids, that's just not going to happen. So it's just talking through those frustrations so that it's not a continuing argument with the child through the rest of the day kind of thing. So that's one of the things that we do that actually works pretty well. Nothing is 100%.
Sure.
And honestly, a lot of it is he just meant, because he thinks so compartmentalized, he really can't intervene a lot of times. He's getting a lot better at it, I'll tell you that. But it's taken, we're 10 years into parenting. It's taken a while, but he's a lot better at now. When I lose it, he'll just kind of say, okay, go take a break. And then he'll go up and talk to whichever child is losing their crap at the moment. So then he comes down and then he kind of talks to me through it a little bit too. And there are a lot of times that I'm the one that does that, because men are not built the way we are, and moms are just built.
Preach, yes.
They're just not. And I know it's just the way it is, but they're just not. So a lot of times, because he can't get to that empathy level in like any realm, I usually intervene. So I feel like it's a lot of me intervening when he's losing his crap, but I know that he does it for me too, and it's getting better. Mm-hmm. But part of it is she thinks a lot like he does, and they both have OCD, but it's a little different OCD. Like they butt heads because their OCD are different. So a lot of it is just me coming in and being like, okay, it's not working. Go take a break. And he gets really mad at me when I do that. But
same.
It's one of those things. You just kind of have to do it. And then he comes back. He's like, I know, I lost it. Right. I should have lost it. But
so talk to me about.
A lot of communication.
So from your perspective as somebody diagnosed with ADHD as a child, if somebody would come at you like that, like many of us, and this is rhetorical, you guys don't need to answer this because I know, because I've talked to most of you guys and some that will watch this playback, that several of us have husbands that do struggle in that area. What would it have been like for you as a child to basically have somebody come at you like the way we were raised? I mean, 30 years ago, it was expected. What I say goes. It's black and white. I'm the adult. You respect me because, and there is no second, third, and 12th chance. Yeah. And so I think that sort of generational thing is an issue for husbands our age as well. But talk to me about that from the flip side, from the child's perspective.
So my dad would do that sometimes because, and again, men are built differently. They just are. And he didn't understand the emotional side of it and like why I was melting down kind of thing. And they just don't have the empathic abilities. I'm not going to say all of them. Mm-hmm. Most of them are not built the way our kids need them to be built kind of thing. But it literally would shut me down. I would go into my room. I would cry. There is no talking through it. There is no, I don't care what you have to say. I'm not interested anymore. And if you try to keep talking to me, I'm just going to scream back. I know it's going to get me in trouble, but this is where I am kind of thing. Like there was no thinking past, okay, if I yell back, then I'm going to get in trouble. I'm going to get spanked. Like there was no thinking past that. I didn't care because I felt threatened. Yeah. And I felt like, not that I wasn't safe, because I was very safe in my house growing up, but I didn't feel safe in that moment. And I knew that I was safe, but I hope you understand what I'm saying.
I totally do. And I think what you're saying about men and women and their differences, and of course that's a gross generality. We all know that that's not every single man and every single woman.
Oh, yeah. It's totally
I would say that if you're talking about just everyday regular life, and this is something my husband and I used to do, something called Therapy Thursdays on the regular page a long time ago. And he's talked very openly about this. Like in regular life, he's super like chill, nothing bothers him. I'm the one that's like, life is color coded and this is when we're going to schedule fun because this is when we have time for it. And that's just my life. And I'm super wound tight. But when it comes to our kids, it's quite the opposite. So every little thing bothers him. So when little adds up, and then it's like explosion town. And for me, I tend to be more empathetic and nurturing, which is just kind of hilarious if you've known me very long, because that is not my just typical nature. It's quite the opposite with my husband and I. Do what?
You know, that's what they need.
Yes, but yes, and that's why I bring that up. I say that to say, I've heard several moms in this group, they've either reached out to me individually or they've said it in a thread or whatever, oh, my husband does this and I don't know what to do. Well, guess what? Neither do I. I wish I had an answer for you. I'd be a millionaire for sure.
Yeah.
But I think it's something about the wiring. I think it's something about, I think men struggle maybe a little more with realistic expectations for age appropriate any child, but especially extreme children. Some of our kids are delayed, some are gifted, or some combination of the two. And so regular age appropriate expectations, even if they know those, they are not usually on par.
Yeah.
And then you have that piece of the physicality. So for a lot of our kids, there's some sensory component, even if it's undiagnosed, or maybe they're on the spectrum or whatever. And so some of our kids are sensory avoidant, some are sensory seekers. And I think many times a male struggles with what's appropriate as far as that's concerned, both with what they feel comfortable with, as well as what's appropriate for their children. And so I know for my husband, he's not very touchy at all, even with me. And like, he's just never been that way. That's not how he's wired. So for him to be that way with our son is very difficult. So something they're working through in therapy and finding it. My son's very much a sensory seeker, and I know your kids are as well. And so they want to climb and jump and bump and tackle and, all of the things. And so they can like wrestle around, and our son gets just as much positive reinforcement from that physical touch as he does if I sit and snuggle him, before bed or something. So I think it's kind of about educating and equipping those people in our lives as well. One thing I wanted to talk to you about, you and I have both been through multiple diagnoses with multiple children. Talk to me about that process, because I know I've mentioned before in this private group about, I'm doing a paper right now on misdiagnoses specifically for marginalized populations such as low socioeconomic status, kids with disabilities, ethnic minorities, that kind of thing. Many of us in this group fall into more than one of those categories. And so what is that like, going through that from the parent perspective, those kind of feelings of fear, anxiety, worry, because you have a daughter, their girls are more commonly misdiagnosed, and a son going through this. So what does that look like for you?
So for me, it's more, I'm finding that we've had to do a lot more, I don't want to say fighting, but pushing and advocating for our daughter than we have for our son, because girls hide those symptoms a lot more, which I think was part of why a lot of the teachers didn't get when I was a kid, because it's just, especially back then, they thought ADHD, like you're jumping off the walls and everything, but that's not always it. Girls usually have that more inattentive part, but Braylon was really good at faking it, because she didn't want to look different. So teachers just didn't believe us for a long time, and we told them in the beginning, this is not something we're looking for, because I was very careful. I was afraid of those labels you were talking about, and so before we had the diagnoses, and even when we were going through the assessments and the evaluations, all that kind of stuff, I was very careful about how I worded things with teachers, just because I didn't want one thing to get passed to another teacher that wasn't necessarily true, and it wouldn't have been their fault or anything. That's just teachers looking out for teachers and kids and stuff, but it wouldn't have been accurate. So we've had to do a lot more pushing for her, and I've had to do a lot more pushing for actually taking her off of one of the medications, and they tried to put her on Seroquel, and at that point I was like, that's not an appropriate medication for her, because she's already taking 4. There's no, I understand why you think that is, but if you prescribe it, I'm not giving it to her. So it was just, and I know they're trying to take care of those symptoms, but at one point they were not trying to take care of the problems. Like, they were not trying to treat it, they were trying to treat the symptoms. And it's like, we have to get down to actually what's going on. Whereas my son, he's 6 and he is not technically diagnosed, although psychologists have him on the radar already here at Children's. So he's very much the energetic, like jumping off of things. Even 2 days post-op from his skull surgery, he was literally hanging on a door like a monkey as he was opening it, and he about gave the nurse a coronary, which I honestly found it funny.
Knowing him, I mean, I've known him basically his whole life, and I'm like, yeah, that's totally
I was like, okay, his personality's coming back, and she was like, don't do that. So But it was very much like that's him. That's just how he does. He's always like that. So it's very, I think when he does go to school, it'll be very apparent more.
Mhm.
And I'll probably get that phone call instead of having to call the school and say, this is what we're doing, which has been the big difference between the two. There's been a lot more of us contacting the teachers and us contacting the schools than I think there will be with him.
Samantha, can I ask you, what has been your experience with that? Do you feel like that girls are able to kind of mask that a little better, and maybe there's some more popular, or that's not the right word, more common, is misdiagnosis is more common with them?
Yeah, I definitely agree with that. For some reason, girls are able to hold it together. And I think it's a part of that. They just don't want to be seen as I'm different.
Mhm.
And I mean, I've seen it as young as like 4-year-olds can do it, you know, and then we get them in different situations and you can definitely tell that there's stuff going on. So that is definitely something that is common and is real.
Yeah. Thank you so much for saying that. I want to, as we kind of wrap up tonight, I want to encourage you guys, if you are watching this on replay later, if you're new to the group, if you're just new to the expert interviews, you have access to the archives of all the videos we've done. And we've done one every single week that this group has existed. So I don't know how many that is, but I feel like it's a lot. It's been around, what, like, Melissa, like 4 or 5 months, and
Yeah.
I did miss a cup. There were like 2 weeks that I missed, but everything else I've done one every week. So go back and check those. If you have a child with extreme needs and they are in the school system, you definitely want to search Melissa's IEP video. That's one of my most watched. It is, I mean, pure gold. But at the same time, I want to make sure that you guys are aware, misdiagnosis does happen. We can't stop advocating for our kids at the doors of the school. We have to do that with doctors. We have to do that with clinicians.
Yeah.
We have to do that with specialists, with therapists. And it's not because everybody doesn't mean well, and it doesn't mean that they're not educated or knowledgeable. And it also includes our family members. I know April just jumped off here, but I was going to say too, she's mentioned a lot like recently about family stuff, and we've kind of all been trying to gather around her and support her in that because we've all been there. But I think that becomes our responsibility as well, to educate and advocate even to the people that love us most on behalf of our kids. So Melissa, what is one thing that you would say to parents that are just starting this diagnostic process, or maybe they're coming into a blended family and this isn't something they've dealt with for a while, and this is new to them and they're trying to kind of get their legs beneath them? What's something that you would tell them that, you wish maybe somebody would have encouraged you with when we all started this journey 8-9 years ago?
Oh man. I think one of the biggest things is just research. Do the research, read the books, read the websites, read the journals, just read it. At one point they were trying to diagnose my oldest with autism, and she's not autistic, but there's a lot of those symptoms that are the same. And so if I had not been educated on what autism is and what it looks like, we might be on a different road.
And for those that don't know, for the research, I just happened to have read this today. The research strongly supports that one of the most common diagnoses is autism or giftedness and ADHD. Those are common crossovers. It's like in some communities up to 80% higher as far as the misdiagnosis they find. It's pretty wild.
And it could be, somebody's trying to say ADHD and it's not ADHD.
Yeah,
it could be
for
something
sure.
else. I guess the biggest thing is when you talk to the doctor, don't commit to anything. Don't say yes to anything until you've had time to do your research. Like if you talk to a therapist or whoever you're starting the journey with, take it in, take a notebook, write down the things that you thought of while they're talking, and don't agree to anything until you've done your research. And then when you go back, you can say, well, I noticed this, and then you're a little more familiar with not only the symptoms that your kid's portraying, but what that could mean. Not just it's got to be ADHD or it's got to be autism, because there's so many things that the symptoms just mirror each other that
And you start to get confidence as you go along. What's the app that you always tell me about to record your meetings with doctors?
It's called Abridge, Abridge. It's free. And you literally, I mean, of course, the doctors want you to ask permission. I use it with schools, with the teachers, with student-teacher meetings, parent-teacher meetings, IEP meetings, doctor visits, therapies, everything. You just open it up and hit record, and it keeps like a synopsis of it, so you can just read a little paragraph of what that appointment was about, so you don't have to scroll through and listen to all this stuff. You can send it to people. It's been really helpful.
Yeah. And then I feel like pregnant brain there's got to be a thing that's like special needs brain. There has to be a like special needs parenting brain. I feel like we need to invent that. I just don't remember anything. There was something that was probably like earth shattering that I was going to say, and now it's totally gone. I don't remember. Oh my goodness. This is real life, you guys. Oh, I know what I was going to say. You mentioned, do your research. So for a lot of people, like for instance, for my husband, and I know several of us have shared this we've commiserated that my husband hates to read. He'll be the first to tell you he would just fall asleep. And it's not because he can't read. I mean, truly, he's college educated, but I don't know how.
Interesting.
And so I might read 1,000 articles and find 2 and then highlight and be like, I really need you to read this. And then he knows that's really important and he really does need to commit to reading that. But I'm the one that's a researcher. I'm the one that's a reader. I enjoy that. I like doing that. But I will say, if you haven't checked out the mamaontherocks.com, do that. You can search any diagnosis, you can search keywords, and there's I think I have over 300 articles on there.
That's actually a resource for me still.
Yeah. And then there's also, I have a library because I am a nerd. And so books that have been super helpful for our family along our journey. And some of them, honestly, were just books that I was like, I remember sitting on my couch crying, reading them, going, holy crap, I cannot believe I am not the only person that deals with this. Like, I really sincerely have that. I will never forget that. And so those books are up there. There's links for you to just click and buy. And I didn't write them. So it doesn't do anything for me except for to serve as a resource for you guys. So do use those resources. That's why they're there. If you guys have questions for Melissa, things that come up later, you watch this on replay and you're like, oh, I wish I was there because I could have asked her this, email me, Bryn@themamaontherocks.com, and I'll connect you with her. As always, she is in our Extreme Parenting private Facebook group, so you can post something and tag her in it. And she's a wonderful resource. And you know that I love you and I'm so grateful. We're praying for you and Jarrett and
Thanks.
Holly. What a wild
home tomorrow.
Yay!